Good evening and welcome to the MyCP webinar series. I'm your host. My name is Paul Gross, and tonight I'm excited to be able to have Dr. Kirsten Allison presenting the results of her study on speech and language predictors of participation in children with CP. So the agenda tonight is I'm going to take you through the standard quick introduction about the CP Research Network. If you are familiar with us, you can feel free to skip ahead to Dr. Allison's presentation, and then we'll end with a Q&A with Dr. Allison. So CPRN was founded back in 2015 as an outcome of an NIH workshop on CP that was held in late 2014. That workshop ended with 5 action areas that the participants were asked to help advance. And I worked with Deb Gabler to advance the concept of a national CP registry. But that ended up expanding into what became the CP Research Network, focused on initially the first 4 of these items, but ultimately all 5 with the addition of Dr. Kruer's work in genetics. CPRN is the merger of 2 core experiences: my personal experience co-founding a clinical research network for hydrocephalus back in 2006, and then the experience of Dr. Gary Noritz, who is a developmental pediatrician and internist at Nationwide Children's Hospital, and had worked on their Learn from Every Patient project, where a single center registry was embedded into the electronic medical record system, which was a fundamentally new way to collect data for a registry. We're patient-centered from the outset, given that I've got a 16-year-old boy with spastic diplegia. And from the very beginning, we had partnered with Michelle Schusterman of CP Now. So some key milestones since we founded CPRN. We launched that clinical registry in March of 2016 and currently have over 5,000 patients in the registry. The elements, or the kind of underlying building blocks that make up the registry, were taken by Epic, the leading supplier of electronic medical record systems, and built into their environment, which has really helped our ability to roll out the registry to many sites. And we currently have 18 sites collecting partial or whole CP population data into the registry. We also launched Research CP, which was an effort to create a patient-centered research agenda in 2017, and that was actually published in 2018 and provides the basis for the focus of our research in the network. We went on to get significant public funding. Some of those milestones were the Pediatric Epilepsy Research Foundation funded support for us to study the crossover between cerebral palsy and epilepsy. And then we went on to get NIH funding with, in conjunction with Dr. Michael Kruer's study of genetics of CP in 2019. We went on to launch a community registry, or a patient-powered registry, in 2019, and that's intended to, instead of collecting information from the visit to a hospital or a clinic, to collect information from you as members of the community about both your lived experience and things that you just wouldn't normally be providing as part of a visit to the hospital. That has over 1,000 participants from the community already, that's split roughly equally between people with CP and caregivers. And then one of our core studies built into the registry is a study of adult well-being that is cross-sectional and follows adults for the long term. We have over 200 participants enrolled in that study. We launched 4 quality improvement initiatives in the network back in 2020. Quality improvement is an alternative way to improve outcomes that complements research projects that have the interesting benefit in that they can improve systems and improve outcomes much more quickly than clinical research, but you use them as a different tool to attack different, more systems problems than individual research questions. And finally, we've had 4 publications to date, over 20 academic presentations, and we have many, many more manuscripts under development, as you'll see a little later on in the presentation. As I said, we partnered with CP Now from the very beginning. CP Now launched as a 501c3 in 2015 with the release of their CP toolkit. And the subsequent year, Michelle Schusterman, their founder, received the Making a Difference Award from the American Academy for Cerebral Palsy and Developmental Medicine. As I mentioned, we partnered to perform Research CP in 2017, and that was through a Patient-Centered Outcome Research Institute, or PCORI, Engagement Award that we got in conjunction with CP Now to run and create that patient-centered research agenda. CP Now followed up with the Wellbeing Guide, a resource for parents or caregivers of kids with CP, and that was released in 2017. And then she went on to get the CP toolkit translated into Spanish and Portuguese, since it's such a valuable resource for families getting a new diagnosis of cerebral palsy. CP Now went on to begin its research funding objective and funded a pilot study in 2018. And then we, in collaboration, ran a Research CP grant for $25,000 in 2020, for which Dr. Kirsten Allison was the recipient, and you'll be hearing about that work shortly. In addition to all of that work, CP Now has also focused on wellness programs, trying to host local adaptive exercise programs, and then contributing to the national dialogue about improving health for people with disabilities, in particular, improving health of wheelchair users. And then Michelle has been very involved in the education around a national fitness program called BeFit that was developed by Shriners. So it was big news for us in January 2021 when, after collaborating with CP Now for so many years, we decided to merge our entities. So that brought together CP Now and CPRN, and then our two adjunct websites that we use to interact with the public, CP Daily Living and MyCP, to form the Cerebral Palsy Research Network. So our combined mission is optimizing the lifelong health and wellness of people with cerebral palsy and their families through high quality research, through education, and through community programming such as our wellness efforts. So the CP Research Network is now a 501c3, and what we do is we bring together institutions, hospitals, universities, clinicians that work at those hospitals, therapists, researchers, and advocates for people in the community, such as yourselves, to conduct research that will improve outcomes for people with CP. While we are spread out in virtual, we have a physical data coordinating center that's hosted at the University of Utah, and they host our two core registries, the clinical registry that we had set out to build from the outset, and that community registry that I described that we launched in March of 2019. And then in addition, we have our education and wellness programs. A big portion of what we do is through MyCP, which is a web portal that's embedded within CPRN.org that allows for a personalized experience based on whether or not you work in CP or whether you are a person with CP or a caregiver. It allows you to participate in our community registry through the form of surveys that you can take on your computer or on your phone. You can participate in discussions about research and share your lived experience, both with other members of the community, but also with clinicians that are interested in working to answer the questions that were raised by Research CP. And it also gives you personalized resources from within our website and our webinars about your experience with CP, as well as access to our free fitness program. Anybody can sign up. It's free at mycp.org. So just to give you a sense of what a registry has, as I said, a registry is a database that collects points of information about people with CP as they come into the clinic. So this is a little snapshot of one data point that we have, GMFCS, or Gross Motor Function Classification Scale, which is this very incredibly important measure of people's gross motor capability, whether or not they ambulate, do they ambulate independently, or do they use a wheelchair? And so you can see this is a snapshot from the registry before we had quite 5,000 patients. And you see how many of the people in the registry were in each GMFCS level. And this is incredibly important for conducting research efficiently. And then on the MyCP side, I mentioned that we have 1,000 members, but that's just the people with CP and providers that are split. I'm sorry, people with CP and caregivers that are split roughly equally. But the whole portal includes over 1,300 people because it includes a large number of providers, researchers, advocates, in addition to people with CP and their caregivers. So that's the set of programs that CPRN has. We have community engagement. And that's a picture from our 2017 Research CP effort on the top left. On the top right is a number of the clinicians and researchers that gathered together for our last face-to-face meeting in Michigan. And then in the lower left, you see our core educational materials. The Cerebral Palsy Toolkit, the Wellbeing Guide, and MyCP, all of which are used for both education and engagement. And then our health and well-being programs that are a growing part of our efforts. So where is the network? It is spread across the United States and Canada. The green pins represent sites that are actively collecting data into the registry. The yellow pins are working on some of the technology to prepare the registry. The red pins are working through some of just the legal agreements to share data with the network. And the blue pins represent sites that have raised their hand and said they're interested in joining the network in the coming months and working through what you need to do to join the network. If you want to see the details of where those pins actually land, you can find that on cprn.org. So our whole goal is to accelerate research. And so this is our pipeline of research and quality improvement projects. The orange ovals are our quality improvement efforts. The green ovals are our research projects. And the idea is on the left, we want to be an open funnel to support ideas that are being developed and to move them along from a concept to being an actual study that gets funding, that gets implemented, that we write up the results, we publish, and then we roll those results back into clinical practice, since all of the sites involved in CPRN are treating people with CP. So tonight's presentation is specifically about something that's moved through this process, which is Dr. Allison's presentation on speech and language predictors of participation in cerebral palsy. So I'm very excited to move to this next phase of our webinar this evening and to welcome Dr. Allison, who is an assistant professor at the Department of Communication Sciences and Disorders at Northeastern University. She has her own lab there called the SMILE Lab that she directs. And as I mentioned earlier, she was the inaugural Research CP Award winner. So she went through a sort of a rigorous scientific review process and then went on to get funding. And so she's reached the conclusion phase to that work. So with that, I will turn it over to Dr. Allison.
Thank you so much, Paul. Thanks for the introduction and overview. And I'm really happy to be here to share my presentation tonight. So let me share my screen. All right, so the study I'm going to be talking about tonight is called Speech and Language Predictors of Participation for Children with Cerebral Palsy. So as Paul mentioned, I am an assistant professor at Northeastern University, where I direct the Speech Motor Impairment and Learning Lab, or the SMILE Lab. And the focus of our lab is on studies related to speech development in children with CP and other neurodevelopmental disabilities. So, and at the end of the day, the primary long-term objective of speech and language therapy and my research is to help maximize participation in all types of life situations and activities for children with CP and other kinds of neurodevelopmental disorders. So we know that effective communication is important to facilitating participation, but not much research has been done related to how best to support communication needs for kids with CP in a way that helps maximize participation. So that was really kind of the focus of this research. So to start, I just want to clarify, what exactly am I talking about when I say participation? So participation is involvement in life activities across settings. So it can be in the home, everything from getting dressed to playing games, having friends over. In school, it can be anything from participating in class discussions to being involved in school teams and clubs. And then there's also involvement in the community, including things like going out to the store and involvement in teams and things like that. And we know from research that participation is really important to quality of life for kids and individuals with CP throughout the lifespan. And so it's a really important focus of all kinds of therapy. And communication is really a key component of participation. So we think about types of participation. Participation is an umbrella term that involves all these different types of life activities I was talking about, some of which rely more on communication than others. So for example, being part of a basketball team doesn't completely rely on communication, though communication would certainly be involved in many aspects of that. Or other activities, for example, talking on the phone or ordering food at a restaurant, rely more directly on communication skills. So these activities fall under the category of communicative participation. So when we're talking about communication, it's important to break down the components of communication to understand what can go wrong and cause somebody to have difficulties with communicating. So communication involves first formulating a message that you want to convey to another person. So that's really the language component of communication. And then for a message to be conveyed verbally, a series of muscles and motor movements are needed to physically produce the sounds that we hear and understand as speech. So that's the speech component. So for kids with CP, they can have difficulties with just impaired motor control of the muscles for speech, or also problems with language, or both. And both of these components can impact communication and the ability to convey your message to another person, and therefore can have an influence on participation. Over 60% of children with CP have some type of communication impairment, and that can include, like I was saying, problems with the speech motor control or language, or both. And about 20% of children with CP are nonverbal communicators. So they may use an augmentative or alternative communication device, or some people use eye gaze, gestures, facial expressions, other kinds of nonverbal modalities to get their messages across. And there's lots of individual variability. And it's important to understand and consider these differences when thinking about how communication relates to participation in kids with CP. So in order to figure out how our interventions, communication interventions, can better support participation for kids with CP, we first need to understand how participation challenges are different for kids with different communication profiles. So there's a framework that was developed by Katie Husted and colleagues that separates children with CP into 4 different communication profiles. Children with no speech motor impairment, children with speech motor impairment and typical language and cognitive skills, children with speech motor impairment who have also impaired language or cognitive skills, and children with no verbal communication skills who can be referred to as anarthria. Please excuse me for just 1 second. Sorry about that. Okay, so this current study used an online survey. God, my 6-year-old just came downstairs. Sorry, he's out of here now. online survey for parents and caregivers of children with cerebral palsy that we developed to help answer these questions. So this was a survey we developed with REDCap, and then it was launched through the CP Research Network's MyCP community registry. We asked parents questions about their child's demographics, including their age, CP subtype, anatomic involvement, and gross motor function level. We also used a variety of communication measures as part of the survey so we could capture different aspects of kids' communication skills and use that to classify children into those 4 speech language profile groups I was talking about. And then we also had measures of participation, including a measure of overall participation, which was the participation and environment measure for children and youth, or the PEMC. And then a measure that specifically looks at levels of communicative participation. This was called the focus. So we ended up having 81 parents or legal guardians who have a child with CP between 4 and 17 years of age participate in this survey. The mean age of the children was 9 years, and there was a pretty much even split between male and female for the kids. In terms of GMFCS levels, so this is the gross motor function classification scale, and ranges from 1, which is ambulatory, having minimal gross motor problems, to level 5, which is more severe gross motor function impairment. So we have a relatively even distribution across GMFCS levels for this study. We also had a fairly even representation across the different speech language profile groups. So 28% fell into this category of no speech motor impairment, and 17% were in this anarthria or had no verbal communication group, and some other groups in between. 70% of the children whose parents completed this survey were reported to use verbal communication or speech as their primary communication modality. For the other 30% were primarily nonverbal communicators, and that was evenly split between children who primarily used an augmentative communication device to communicate versus other types of nonverbal communication. So I'm going to talk about the results of this study. So the first question that we were asking was, how does participation differ for children with CP based on these different speech and language profile groups? So first, we looked at how these speech and language profile groups related to communicative participation. And in all of the analyses that I'm going to be talking about, we controlled for children's age and GMFCS level. So what we found first, you can see in this graph here, this is showing the focus total score. So a higher score means higher participation levels here, and the lower score means lower levels of communicative participation. And these different colored bars represent the different communication profile groups. So what we can see here is that you can see a difference, obviously, in the communicative participation levels between these 4 groups. And what we found was that the children here who have both speech impairment and language impairment had significantly lower levels of communicative participation than children who only had speech impairment. And the children who were nonverbal communicators had the lowest levels of communicative participation. So next, we looked at overall participation and frequency of participation in activities across settings, regardless of whether or not they were specific to communication. So the question that parents were asked here is, which of these, or how frequently does your child participate in these types of activities? And this was averaged across 25 different activities in home and school and community settings. So what we found here is that across these communication profile groups, there were really only small differences in how frequently children were participating in activities based on their speech and language profile. But when we looked at how involved the children were, that did depend on their speech and language profile. So parents were then asked for the activities their child participated in. Parents were asked to rate how involved their child is when they are participating in these particular activities on a scale from 1, minimally involved, to 5, very involved. So what we found here is that the children with both speech and language impairment and the children in this anarthria group had lower levels of involvement in activities than the children with only speech motor impairment or no speech impairment. So what this suggests is the importance of communication skills for being actively involved in these activities across settings, even if the activity isn't specifically about communication. So the second question we asked is, for these children who have speech impairment, for the speech motor impairment, how does participation differ depending on their communication modality? And by communication modality, I mean whether they're primarily verbal communicators, use an augmentative communication device, or some other type of nonverbal communication. So the first thing we looked at is whether there were differences in communication participation scores between these 3 groups. So these verbal communicators are children who have speech motor impairment, but their parents reported that they primarily use verbal communication to communicate. The second bar here is children who were reported to primarily use an augmentative communication device. And then this group is children who primarily use some other form of nonverbal communication as their primary communication modality. So what we found here is the children who were nonverbal communicators, both the AAC users and other nonverbal communicators, had lower levels of communicative participation than the kids who were verbal communicators. Then we look at frequency of overall participation. What we found is that the AAC users participated in activities as frequently as the verbal communicators. And these children who used other forms of nonverbal communication had lower participation frequency than the other groups. And when we looked at the level of involvement in activities, the results were similar. So the AAC users varied in their level of involvement in activities overall, but these other nonverbal communicators had significantly lower levels of involvement than the verbal communicators, but the AAC users did not have a significantly lower levels of involvement. So this suggests that using an AAC device for children who are nonverbal can really help facilitate participation. So the conclusions here, the main takeaway or conclusions are, first, that children with CP who have both impairments in speech production and language, and those who have no verbal communication, are at the highest risk for participation restrictions. And then for children with more severe speech impairment, AAC use may help increase overall participation frequency and level of involvement across these different kinds of life activities. So some take-home tips really for messages for parents and caregivers from this research, I think, are first, that if you have a child who has both difficulties with speech and language, you want to think early about communication supports as they pertain to everyday life activities and things that can help facilitate that participation. And then also relatedly, to talk with your child's speech language pathologist about your participation goals for your child. What are you hoping? What kinds of activities would you like them to be more involved in? How is their communication standing in the way or presenting a barrier to that? And then how can you work together with the SLP to help figure out strategies to maximize the child's success in communicating in those situations? I think the other main take-home point is that you don't want to take a wait and see approach to augmentative communication. It can really be a helpful facilitator to participation. And so even if it's a child who may not need an augmentative communication device for their entire life, in early ages, it can really help with maximizing participation for kids. And for medical professionals, some of the take-home points here, I think, is number one, understanding that communication is really an important component of participation. And so that really refer your kids, your patients with CP to speech language pathologists early on, and recognize that really that communication is a core component of what's going to help maximize their participation outcomes. I would also encourage medical professionals to talk with a speech and language pathologist on your team about both the child's speech and language skills, so you can have an understanding of whether your patient is having trouble in one of those areas or both of those areas, and to help reinforce the importance of augmentative communication as a strategy for many kids with CP. All right, so that's the meat of the presentation here. I want to thank members from my lab. This is not a comprehensive list of everybody in my lab, but these are the students who helped most with this project, especially Kayla Doherty, who did her master's thesis with some of the pieces of this project. Also, I want to thank Paul for all his help with this project and getting it launched through the MyCP registry. It was, he spent a lot of time and effort helping me with this, and I'm extremely grateful for his time and also the grant support from the CP Research Network and CP Now, and other people who helped. All right, thank you.
Well, thank you very much, Kristen. That was awesome. Here, let me. You ended the share. Okay, so let's open it up to questions. For you, I had one that I just forgot, but I'm sure someone else will dive in. And while I think of the question I was going to ask, I may need to look at your slides again.
Oh, okay. I can reshare it.
No, I'm okay for now. It'll come to me in a moment. But does anybody have any questions for Dr. Allison? Come on. No, you do. So go ahead.
I'll ask one.
Go ahead, Danielle.
This is Danielle Barber. I am from Philadelphia. I am both a parent and a clinician. And I think your work is super valuable and was really beautifully presented. So congratulations on that.
Thank you.
I am wondering what is next. I think a lot of what you presented seems intuitive, and that doesn't mean the work doesn't need to be done. It absolutely needs to be done, because we can't just rely on our intuitions. We have to see if we're correct or not. So where are you thinking for next steps with this?
Yeah, great question. So I think a few things. First of all, I think there's a lot more granularity we can get into with looking at the types of activities that in terms of participation that are more challenging for children with different types of communication abilities. So, for children who are AAC users, are there certain types of activities that tend to be more difficult from a participation perspective? And so I think, this first step is looking at really kind of global measures of participation. And I think we can dive deeper into those to look at subcategories of different kinds of activities to get a better profile of what types of activities might be more challenging for children to participate in based on their communication profiles than others. The other thing that I'm really interested in kind of diving into more is this difference between the children who have speech motor impairment only and the children who have comorbid or have both speech and language impairment together. Because while it does seem sort of obvious that kids who have problems with both will have more problems with communication and participation in those kind of interactions. I think often there's a lot of focus on speech intelligibility, how just understandable a child's speech is, and people make inferences about a child's communication ability based on that without always looking as much at the language component. So I also think we need to look at severity of intelligibility impairment within these two kinds of subgroups, and how the degree to which speech intelligibility as well as language on a more scale, like a language severity, plays into some of these measures as well.
Yeah, that's super interesting and super useful. I think that sounds great. I'm happy to quiet down if other people have other questions, but otherwise I'm happy to share a little bit about things that I'm thinking about a lot. So definitely clinical perspectives for sure, but obviously my perspective is very much impacted by my daughter. She's 10, and in addition to CP, she has selective mutism, which makes it really complicated for her to communicate at school and to demonstrate at school a lot of her knowledge, right? So it's complicated because we end up having to teach her a more advanced level at home, and then at school she's not able to demonstrate that she understands a lot of those concepts just because the communication piece is so challenging. And we work a lot on just practicing social communication to get participation at school, where you know, and then there's a different level of communication at home or in more comfortable environments. So I definitely think that you're right on for looking at how this impacts participation in different environments. It's so critical. It has impacts on every aspect of life, of course, and absolutely agree that the motor component is separate from the language component. So I don't have a particular another question, but I love the work and keep going.
Thank you. Thank you for sharing that. Yeah.
Let me turn it over to Duncan and then David.
Kristen, I'm being a former junior high school teacher and having worked a lot with the deaf community. What has been the impact or role of text messaging, particularly for the adolescent age group that you're working with?
That's a great question, and not something I actually know a lot about. So I'll try my best to answer your question, but it's not something I have looked at specifically in my research. And I would imagine that you know, that texting or you know, in my clinical experience, methods that use typing or text to speech kinds of things, or predictive text, can be very helpful as a tool for some people for communication. But I think it is also depends on the fine motor control, right? For people with CP, for some people, it may be a more efficient means of communication, and for other people, it may not be. So I think that is a complicated kind of issue, but a really interesting area to explore, especially for that teenage population, like you said, where it's a really key component of their social participation. So I think that would be really interesting to look at.
Not that you collected it, Kristen, but is there any data that correlates MACS, so manual ability classification scale, to, you know, any of the other sort of aspects where you could at least say you would know that for maybe 40% of this population, they would have a, reduced manual ability, and therefore, I don't know, just another data point.
Yeah, I think, there's definitely there's some research out there that looks at the correlations between, like the community CFCS and MAX and GMFCS. So I think there would be, definitely an interesting direction for sure.
David, you're up.
I'm up. Okay. Well, first of all, Duncan stole some of my thunder. But I'm thinking of it kind of differently from, has anybody thought about whether surgical procedures would be able to help? I'm not thinking so much in regards to language. I'm thinking more in regards to the speech angle. If there are certain surgical procedures that might be able to help the child as they get older.
So in terms of surgical procedures for speech, there are not a lot out there. A couple of things for children who have a lot of difficulty with moving their soft palate, they can be very hypernasal. That if that is really extreme and having a major impact on intelligibility, it's not usually surgery, but something like a prosthetic, like a palatal lift, can be used sometimes to help get better closure there, and that can help reduce that hypernasality and improve intelligibility. Okay. A lot of kids with CP are not good candidates for that because it can be really hard if you have a hyperactive gag reflex and tolerating it and a whole bunch of other things. So I've rarely seen that be something that is used or helpful for kids with CP.
Because, oh, go ahead.
The nerves that serve the speech musculature are cranial nerves in the brainstem that originate in the brainstem. And so there could be cortical things, like, for example, in adults with Parkinson's disease, deep brain stimulation has been used, and there is some research about how that affects speech production, but oftentimes it has a different effect on speech than it does on gross motor movement. So it's not, there's no real, there's not like you can't like Botox the jaw and have it immediately help speech the way you can with some other muscle groups.
So I think the next question's from Marcy.
Hi, Kristen. I hope you can hear me. Thank you so much for your research and for contributing to more research in this area. I'm a speech therapist in Seattle, Washington, and run our AAC lab here. And I'm primarily clinical. I'm not research. So my question to you is to take your research, the point that you made about separating the participants out into the different groupings, and how you are able, I don't think I caught how you were able to know which kids had the motor speech impairment, and if that was a parent report or if you directly tested that. And thinking about some of Catherine Hustad's research about at what age, so was there a point at which you just couldn't tell that there was that distinction with the motor speech issue?
Yeah, so for this study, it was based on parent report. And so what we used was the Viking speech scale, which was developed by Lindsay Pennington. It's developed specifically for kids with CP, and it rates severity of speech motor impairment on a 4-level scale. And it's shown to match up. It's been validated against like transcription intelligibility measures. So for this study, because it was a parent survey, we weren't able to get that. So ideal clinician-based measures of speech motor impairment. So it may not be perfect, but it's, and we actually did a pilot of this study with a few people where we did know the kids and knew their communication profile groups, and made sure that the parent ratings based on these measures matched up with the kids we knew. So we did that on a couple of kids before we launched this widely. And the kids the parents, we recruited for this study kids or parents of children between the ages of 4 and 17. Okay, so under 4. So the research that I did with Katie Husted in my doctoral program, because she was my PhD advisor, we looked at communication profiles in like 2-year-olds and 3-year-olds, and at those ages, you're not really able to separate out those components particularly well. But from ages 4 and up, that's why I focused on that age group for the study, because that's the age at which we can more reliably separate out the speech and language components.
Thank you. That's great. I appreciate that.
Mm-hmm.
And I look forward to more research.
Thank you.
So Kristen, I have a question for you. So I just don't have a lot of sense of this. I know David was asking about a surgical intervention, but taking interventions broadly, like use of AAC as an intervention, are there a lot, or like what's the armamentarium of intervention look like for kids with speech or language impairment? And is there like an equivalent of an early detection benefit because of neuroplasticity or anything like that? I'm curious. I have no idea what that field looks like. I'd be curious.
Yeah. So I'll give you the kind of quick and dirty overview, which is there are a limited number of interventions that are specific for improving speech motor impairment intelligibility, that are geared towards improving the intelligibility, that have been shown to be effective for kids with CP and dysarthria. And they have mostly been looked at in kids that are school age and older. There's virtually nothing that's focused on preschoolers or like at really young ages. It's on my agenda. But in the types of interventions that have been shown to be effective are ones that don't just focus on articulation of speech sounds, but focus on all of the speech subsystems. So respiration, so breath support for speech, helps improve clarity of phonation and vocal quality, and also can carry over to improvements in articulation. So there are, and some interventions focus on having kids modify one dimension of their speech, for example, using loud speech or using a big mouth, and having kids focus on one of those specific cues can show improvements throughout their entire speech mechanism and boost intelligibility. So that's where the research stands. So there's some support for those types of interventions. The problem is that a lot of those focus on the children or rely on the children having some ability to some meta awareness of their speech and some ability to kind of think about how they are talking as they are talking, right? So they have to be able to do some self-monitoring. So that's why it really works better for kids who are a bit older than the really little kids. So we know that interventions need to address not just articulation, but all speech subsystems. And we know that interventions need to follow principles of motor learning that consistent with other kinds of motor domains. So we have to have, the appropriate intensity of practice and things like that. And that hasn't been always, because there's not a lot of research evidence supporting that, that's not always done in speech pathology. It's not something that a lot of families have access to, or is not a typical model of care for speech, unfortunately, yet. There's a lot of research out there on language interventions, not specifically for kids with CP, but kids with all sorts of different kinds of neurodevelopmental kinds of disabilities have problems with language impairment. And there's loads of different kinds of evidence-based approaches for that, depending on which aspects of language kids have problems with. But I think, one thing that I see is that sometimes kids with CP who talk but have some reduced intelligibility and maybe some mild language problems, but that's better than their gross motor skills, like aren't referred for speech. They're like, oh, well, they're talkers, they're doing okay. We need to focus on this other stuff. And then their communication needs really aren't addressed until much later. And what we know from Dr. Husted's work is that in terms of speech intelligibility, between ages 3 and 4, kids are showing the highest rate of intelligibility gain. And so that's a period of time where we really need to maximize therapy, but that hasn't actually been, work hasn't been done yet.
Yeah, I wonder given all the work that's going on in early detection, and I know they're still developing evidence for the early intervention, and much of that sort of gross motor, plasticity kinds of things, just strikes me as an area that's probably rich for and ripe for, impact. But again, it's hard to get the sort of baseline data and whatnot. So it's interesting. Yeah. Great, interesting area. Other questions? All righty.
I have one more, Paul.
Go ahead.
Is there some parallel studies being done, Kristen? This is more under the umbrella of communication. And as we all know, there's a lot of communication that is nonverbal. And individuals who have a whole range of neuromuscular issues also tend to have body movements or facial expressions that really mess up the quote normal, whatever that is, normal nonverbal communication. I remember back in Barcelona at the Paralympics, meeting an athlete from Italy who had significant aphantoid characteristics. And he was very proud of the fact that he said, well, we Italians speak with our hands anyways. So my aphatosis is a perfect match. But anyway, in terms of, I know your focus is on language and speech, but any studies out there on those nonverbal cues? And
yeah, great question. And I know that there are definitely people doing studies on these nonverbal cues. I'm not aware of any that are specific to CP. But one aspect of nonverbal communication that has been studied is prosody, so intonation, which is a kind of a component of speech, but just, how you change your pitch when you're talking can convey sarcasm or not, different intents. And so that's kind of an aspect of nonverbal communication that is affected with by motor control problems as well, that affect the speech mechanism. And so that has been looked at in speakers with CP, and actually the research on that I know of has shown that that speakers with CP and dysarthria use different cues to mark stress and intonation, and so they'll rely more on changes in loudness or duration rather than pitch, or different kinds of cues maybe than speakers who don't have those kind of neuromuscular issues, but that they are still able to kind of mark prosody in many cases. So I think that people find ways to kind of indicate some of those nonverbal cues, even if it's not in a conventional way. I don't know.
I know certainly when I was younger, one of my greatest frustrations given that my accent, my cerebral palsy accent, I have a slower speech pattern, and I was constantly running into the assumption that since my speech was slower, my intellectual abilities were slower, and would often be perceived as somebody with a cognitive or intellectual disability simply based on my speech pattern, my accent.
Yeah, I think that is something, unfortunately, that people run into quite a lot, and is really.
And I think it was particularly acute in my late teens and early adulthood, my college years. I found that extremely frustrating.
I can only imagine, and I hope that we continue to have better advocacy on this issue, and so that people become increasingly aware that differences in speech motor control have nothing to do with intellect.
So I'm going to let Haley's got her hand up. I'll let her ask the sort of final question. We are rounding the hour, and this sort of change of outfit is I'm actually going out mountain biking. So so go ahead, Haley, ask your question. No pressure.
Thanks, Dr. A. It's good to see you again.
Hi, Haley.
So I am a graduate student at the University of Washington, if Dr. A knows. But we were talking a lot about participation-based goals in speech pathology work. How would you suggest assessing participation with our clients and looking at where there may be an issue and where we can support?
Yeah, great. So I think there are some measures that are being developed for this purpose. So you can use the focus that we used in this survey. That's a measure that's available, and there are other measures that are specifically designed for assessing participation in children too. There's one called the SPA-C. I'm happy to send you a list of these if you want. But there are increasing numbers of tools specifically designed for assessing participation in children with speech and language impairments, and really incorporating both parent perspective and also the child's perspective. For many kids, they're just never asked, what is hard for you? What do you wish was easier for you in terms of your communication, and how do you feel about your communication in these different situations? And so now that there are some tools available that do exactly that and can be really helpful in goal setting.
All righty. Well, Kirsten, Dr. Allison, thank you so much. I hope your son's okay. It was great to have a little appearance. Don't worry. Hey, look, I didn't record my opening, so I gotta go back. And so anyway, I want to thank you very much for your work, your presentation tonight. It will be posted. It's going to take me a little longer because I got to upfront it now with another piece. But anyway, great work, and I look forward to. My question did get answered, was where do you go next? And so I look forward to working with you more, and I wish you the best of luck in taking this research forward. So thank you very much.
Great, thank you so much, Paul, and thank you everybody for coming.
Bye all.
Thank you.
Thank you. Thank you, Kirsten.
Thank you, Duncan. Bye.